let me share with you the exciting story of MediKarma and Jill AI. This is more of a story of you and I, a consumer story. And I'm going to try to weave in how this is playing into the value-based care and cost of care proposition. So to go back to the story, like most of you, I've been walking around feeling invincible most of my life. And when I was diagnosed with diabetes 2, I saw some signs, but I valiantly ignored it. And I continued to see early signs, few of the developments. But finally, when the pandemic happened, I realized I need to take care of this because I was afraid of being intubed and being lonely in some hospital. So I started applying myself to figure out what's going on with my body, trying to understand what's happening, what do I need to fix? And pouring through my data, I realized diabetes 2 needed me to take certain steps. So I started working out better, eating better, sleeping better, so that I got my body strong, so that I can fight COVID if it happens. So the short story is, over 3 months, I drove my blood glucose measurement from 220 in the mornings to 110. This kind of motivated me. If I know what's going on with my body, and if I start taking actions, there is a chance I can overcome and prevent further complications. This is the story of MediKarma and Jill AI. So my goal was to repeat what I did by creating a sticky app, as sticky as something like Instagram, that would engage patients, that would coach them about their body, show them what they can do, and finally help them towards preventive care. So I'm going to share with you my screen and tell you about this technology. Then I will zoom on to how it's playing out in the market. But there are a couple of things we learned back in my experience working with folks like Apple or Smart TV. When it comes to consumers like you and I, we don't fix what we don't see. So if I'm going to show you about your body, I need to be able to provide a digital twin of you and show you what's happening with your body. You don't improve what you can't measure. So I need to be able to provide you a way to quantify and measure your progress. And finally, one of the biggest things people will tell you when it comes to consumer communication, mass communication, is bite-sized chunks of data, preferably conversational, preferably action-oriented, and most importantly, 7th grade English. Keep it very simple. So with that, let me show you my screen. So MediKarma technology, let me talk about technology first. As you and I are talking right now, if you want to use MediKarma with your consent, I create an avatar of you. And with the avatar and with your consent, I'm able to go get all your EMR data and bring it in and display around your body the state of your organs, the risk you have, your cardiac risk, your stroke risk, your kidney risk. All this presented to you like a check engine light, green, orange, and red, and quantified what are the things you can do. We take this state of you as of today, and we combine it with how you're behaving and project where you're going to end up in the future. Putting it otherwise, if you change your behavior, you can change your outcome. Basically, you can prevent. So we are connected to any of the smart devices, Apple Watch, Fitbit, Oura Ring, Libre. We are connected to your RPM devices, blood pressure monitor or scale, or SpO2, few other devices. Finally, I'm going to show you your virtual health assistant, Jill. She will be talking to you every morning. How are you feeling? How's your stress? I see that you didn't sleep well last night. Anything you want to share with us? So the 4 streams of data, EMR, smart devices, RPM devices, and subjective answers, are taken to compute what you see on the left side, a FICO-like health score. This was meant to gamify your digital twin, gamification of your score. And the goal here is every morning, how to take you from the score of, let's say, 600 to 610, one step at a time. How do we do this? We show you your score drivers. Why did your score go up or down? Yesterday, you ate well, your score went up. You worked out for an hour, your score went up. But you did have 3 glasses of wine last night, so your score goes down. And every time you look at the score drivers, and let me just show you a click here. Let's go to cholesterol. Your cholesterol is 86. What does this mean, long-term or short-term? What are the 3 things you can do to improve? The powerful consumer concept. What do I do next? So we basically show you where you are. We show you how you're behaving. We tell you what can you do to improve your condition. All this is done through a conversational, actionable AI Jill. Let me show you Jill. So Jill AI, you've been hearing a lot about ChatGPT. You can write a term paper or pass an exam. What we have actually created is a personal, responsible AI that can actually talk to you. This is HIPAA compliant. It can authenticate your ID, and you can actually store your information securely. It can tell you, answer your question, that's general question, what is diabetes? Or it can answer a specific question, what happened to your glucose measurement yesterday, your comorbidities. So we are designing Jill to be able to talk to you every morning. I'm going to show you a demo towards the end and show your twin, your score, what do I do next, all this combined. Jill and MediKarma is now being designed in by some of the major payers and providers in healthcare. The best way to describe Jill, this is not just another LLM that's going on in AI side. This is actually large knowledge model. We create safe streams of data, general data like World Health Organization, or your personalized data like your EMR or your smart devices. And we feed this to any query that you may ask, and we give you a very simple, straightforward answer. That's how Jill works. Now, as we put this together, we realized the market opportunity, talking to customers, was value-based care. $1.6 trillion market. It's been going on for 8 years with barely 20% penetration. When we talk to payers and providers, and some folks in CMS, what we kept hearing was they have most of the pieces of the puzzle, but they didn't have the piece to engage patients before they get sick, to engage patients so that they can monitor their health and they can move on to adapt to the medication, change the behavior, and send this data to the doctor. So basically, this is the opportunity that we are addressing. The app, as it shows in the mobile app, and let me finish off before I show you a demo. As we said, we are working with a bunch of customers, getting ready for launch. The product has already been deployed with Global Cancer Research Institute. We have onboarded about 4,000 patients already. We are doing 3 trials in California, Arizona, and Florida on value-based care economic study. And MediKarma is slowly getting popular, getting some innovation awards and getting some prominence. So with that, I would like to quickly take a minute and show you a demo. Because I'm doing this virtually, I just have to show you my phone. Hey, Jill, how am I doing today?
Hi, welcome back. It looks like you're making great progress toward your health and wellness goals. Your health score went up by plus 25 points over the last week. Keep up the good work. Do you want to learn more?
Yes.
Your improvement in score is mainly driven by blood pressure reading, which decreased to 130/80ths of a millimeter of mercury. Your goal is to get to 120/80ths. Secondly, increased GFR score from 60 to 75. I got this information from your recent lab results. Your goal is to get to over 90. You are moving in the right direction. Keep up the good work.
Can you explain me what is GFR?
Sure. The glomerular filtration rate, GFR, is the rate at which blood is filtered by the kidneys. It is a measure of how well the kidneys are functioning and is used to diagnose and monitor kidney disease.
Okay, so what I do next?
Your latest recommendation is as follows. Your blood pressure value has recently increased. You have hypertension. It's imperative to implement lifestyle changes to lower your risk of hypertension. Please discuss with your medical provider to help you ensure optimal control of your blood pressure, including
So basically, I can carry on a conversation every morning. Typical way we are designing this, it's all about Jill touch points. You get up in the morning, you step on your scale goes to cloud goes to MediKarma. Jill will be sending you a message congratulating you for losing half a pound and what you did right and what can you do more. If the weather is outside getting tough, Jill can give you an indication, wear your mask or be careful going out. So we are implementing MediKarma and Jill to be the premier patient engagement portal focused on preventive care. And our goal is to get each one of us be aware of our health, focus on getting healthier so that we can live a very happy, long life. Thank you.